Hi friends, this video is made on request with Dr. Saurabh, who just told me to share my experiences regarding sports nutrition and some sports supplement. I'm also going to share my experience with some of these, and I'm also trying to help you in busting the myths regarding the sports supplements that are available. So first of all, I'd like to share something about the human hormones. So as per our needs, whenever we want to lose weight, the most important hormone is insulin, right? So we have to remember these two things. Whenever we have insulin in our body, we are not going to burn any fat, right? So insulin is the most important compound regarding the fat loss is concerned, and it is also the most important hormone regarding the muscle gain is concerned, right? So first of all, whenever we are having more amount of belly fat, we are having more and more insulin resistance, as we all know that. So the main target is to start the body responding to insulin so that we start responding to the lowest level of insulin that is present in the blood, right? So whenever we are taking a lot of carbohydrates since a long time, that includes grains, multigrain breads, cereals, our body is becoming more and more standardized. It is becoming more and more insulin resistant. So we need to first of all give a break to the insulin level, right? So how we can do that? So there are two important aspects of this. One is called an intermittent fasting and one is called a keto diet. Intermittent fasting is basically not eating anything, only black coffee and clear liquids are allowed. So whenever we are not eating anything in the body, that is the only time the insulin is not going to produce, right? So we can start with basic level of intermittent fasting, that is basically 16-8. 16-8 is basically 16 hours of fasting and 8 hour of feeding window. As per your workout timings, you can schedule the fasting with the feeding window. So if you are doing a strength workout in the morning, continue the fasting and then you can have your meal after the strength workout. And if you are doing the strength workout in the evening, you can extend your fasting window till evening time and then you can take your first meal, right? Initially, if you are not happy with 16-8, you can start with 10 hours, 12 hours, 14 hours and then 16 hours, and gradually you can take it to 28, right? Some people are also extending it to complete day of fasting. So complete day of fasting regulates the insulin secretion. Sometimes the people are not able to have a fasting window. They need something to eat. So the second option we have is called a keto diet, right? So keto diet, right? There are a lot of myths regarding the keto. I can drink milk in the keto. I can have seeds in the keto. I can have nuts in keto. Exactly what is keto, right? Keto is a diet which induces the production of ketones in your body. And what are ketones? They are a byproduct of fat burning. So whenever we have ketones in the body, our body will try to burn those ketones. But the essential thing is your glycogen level has to go down to the level that the body starts burning those fat molecules that are resistant in the body, right? So how do we do a keto diet? A keto diet essentially will have 70 to 75% of fats, 20 to 25% of proteins and less than 5% of carbs. It will not have any dairy product except cheese, paneer, and it should be a pure ghee, right? So the maximum thing is to take a fat. The fat you can hit a target of around 70 to 75% of fat in the keto diet. When you start going into ketosis, you will have a brief period of keto flu followed by the proper ketosis, right? And whenever you will go into keto, you will have magical results, you will have standardized fat burning, and you will have a lot of energy. Just imagine yourself burning a rocket fuel as compared to a standard glucose. The important thing in these is keto diet doesn't allow any cheating, right? So if it's alcohol, it has to be a clear alcohol, only whiskey and vodka. It cannot be a beer or something. And it has to be a consistent diet. It is not like you can do 3 days in a week, 4 days in a week and switch on, right? So keto, if you are doing the keto, has to extend for at least a period of 3 weeks to 4 weeks. There are people who are on keto diet since 4 years, 5 years, 6 years. And there are a lot of myths that people die on keto. I personally, I have done keto for around 9 to 10 months. And I have not felt anything like the people say that you die on keto or something, right? Another important aspect that we have to still remember is caloric requirement, because ultimately it's the goal of calorie in and calorie out, right? So there are a lot of formulas available for maintenance calories. So we can calculate our maintenance calories, and if you are on the cutting phase, like you want to lose weight, start with going into 500 calorie deficits, and then you can gradually progress. Eventually, if you cut out a lot of calories in a go, you will eventually slow down your basic metabolic rate, and then you will not have any results. You can see a lot of people saying that I am only taking one chapati, I am just take one bowl of rice, and still I am not losing anything, because cutting down on your calories too much makes your metabolism sleep. And when your metabolism is sleeping, you are not burning anything, right? So we need to work on just 500 loss of the maintenance calories. Eventually, when you want to gain weight also, just add 500 calories additional, and then you can eventually increase the amount of calories as per your requirements. You want to bulk up, you want to lean down, that is important. So just remember the formula, remember that how much calories you want, and just add 500 or just reduce 500. So second important thing after the calories is the protein in your diet. It is the magical factor, it is the major factor. Every diet should have a protein. Breakfast, lunch and dinner, we should hit the protein target. Important thing is, if you want to increase your muscle mass, your target of protein should be 1.5 to 2 grams per kg lean body weight, right? So per kg lean body weight is, you just calculate your fat percentage and then hit whatever you want to hit. And according to the target, the minimum should be at least 0.75 to 1 grams, and the maximum you can go up to 2 to 2.5 grams per kg protein that is required. And important thing is to distribute that protein all around your meals. It has to be some amount in breakfast, some amount in lunch, and some amount of dinner. Even if you are not hitting on carbohydrates and fats, the important target is to hit the protein content right. Okay, so the important and most important diet factor in your diet is proteins. Another important thing that protein does in your body is called thermogenesis, right? Thermogenesis means the amount of calories that your body needs to burn the food. So whenever you are taking maximum protein, the thermogenesis is high, so your body needs more calories to burn those proteins to give you results. So eventually more calories is burned when you are taking more protein, right? So now in very short and brief, I'll also like to discuss sports nutrition and the sports supplement, because I have seen a lot of people getting confused with this. I have seen one of my very close friend who said to me, "Arey tu protein pi raha hai, tu mar jayega," right? So that is a major problem, because people, even the medical fraternity, even the doctors, they don't know actually about the whey protein, right? So the important thing is, whey protein comes in many forms. They come in isolate, they come in hydroxylate, they come in simple way, they come in complex way, right? So any way is good for you, because we are not at that level of 8 to 10% of body fat where we have to drink only isolate, we have to drink hydroxylate. We can take any protein. The important thing is to hit the protein goal, right? Whatever type of protein you take, just stick to that, that's fine. Some people have digestion issues with protein, so they can switch to isolates, because isolates become more refined and it becomes more easily digestible, right? Another important form of protein is casein. So casein is basically a slow acting protein. It is basically giving you a longer protein spike, which is basically for a longer duration and which is not that high. So if you want to sustain protein coverage, like if you have not skip your dinner or skip your breakfast and your lunch is there, you can take a casein, and casein will give you a longer duration of protein enhancement in the body. Another important thing that people think is that I can't take whey protein because my kidneys will damage. So if you have normal kidneys, the kidneys will adjust to the amount of protein you are taking. This is as per the NCBI guidelines. If a person has got a normal kidney, he can digest the amount of protein, and the kidney will start functioning to the amount of protein he is taking naturally, right? But if you have proteins allergy, you have some allergy components in the kidney, then the protein content has to be reduced accordingly. But as such, as far as whey protein is concerned, you can take whey protein even when you are having high uric acid, because whey protein doesn't correlate with the uric acid level hiking, right? Second important supplement that you have seen a lot of people taking, branch chain amino acid. So branch chain amino acid is a no substitute for whey protein. So you can't think कि मैं whey नहीं पी सकता हूँ तो मैं 5 scoop BCAA पी लेता हूँ. That's not right, because branch chain amino acids are only the essential amino acids. They are going to help you in your workout. They are going to help you in giving you a slight taste and flavor, but they are a non-essential supplements. I'll not recommend you to stick to a branch chain amino acid. You can take it if you like, and you can take it during a workout. Another important supplement is creatine. So creatine monohydrate, It is a supplement which a lot of us take to increase our strength, and yet creatine is the most successfully and most enhancedly and deeply studied supplement. 5 grams of creatine monohydrate can be taken. So even if you are having some loading issues with creatine monohydrates, like you feel bloating, then there are creatine HCl or creatine hydrochloride supplements available, so you can go for them. Important thing with creatine is the water intake has to be good. So ऐसा नहीं होता है कि creatine खा ली बॉस मेरी किडनी खराब हो गई. It's not like that. Creatine, 5 grams of creatine is okay for you, and it will give you a sustainable results if you take it regularly. Don't expect it work like a pre-workout and a caffeine and give you instant spike. So creatine monohydrate has to be taken regularly, and it is a successfully studied supplement with no side effects. So friends, thanks a lot for the patience, because I have tried to cover a lot of things in a short span. For any queries, you can just come down to me or text me anytime. Thanks a lot.